Nearly 90% of the world's student population is out of school due to corona. You can't even leave your house. You can't leave your state or even your country in many cases. And whether you're on the side of those who are worried or the side of those who are in complete denial, it's safe to say we all have been affected in some shape or form now by corona. But how do we keep ourselves safe? I asked our in-house expert, Dr. Michael Jones, my husband, to join us to talk about this because, well, we have nothing to do but talk these days.
I've got nothing but time on my hands, so I'm glad to be here.
Yeah, it gives us a lot to talk about. So let's dive into the coronavirus versus the flu, because that's one of the biggest questions that I've seen, and a lot of people have been asking, why should I be more concerned about this than the flu when the flu to date has killed more people than corona?
Well, you're absolutely right. The flu ultimately will kill or has killed more people than corona. We don't know where coronavirus is ultimately going to go and how many deaths there ultimately will be, but from what we have seen, the death rate is much higher than with the common cold or the common influenza bug. So we're looking at a death rate with the influenza of about 0.1%, whereas with coronavirus, it's looking like it might be 3, 4, maybe even higher percentage. So 30 to 40 times higher kill rate when you're infected with coronavirus than with the common flu.
Right. Now, that is, though, if you have an underlying medical problem, right?
That is what we initially thought, but we're finding that even younger kids who or younger adults that were supposedly healthy are still succumbing to this virus. So we don't understand completely whether it's because they had some pre-existing lung condition that was unrecognized. Perhaps it might have to do with vaping. We're not really certain.
Well, can we talk about that? Because that's something that's a big concern to a lot of parents, parents that know their kids are vaping and those who are in denial about their kids vaping. Either way, there's a lot of research that would show that this could potentially put teens and young adults and any person at higher risk because your lungs are compromised, right? And this is a pneumonia.
This is an inflammation of the lungs that causes a consolidation that doesn't allow oxygen in, and ultimately the organs will fail. Vaping, we still don't, it's still an unknown, right? We don't understand exactly what it is that's caused those multiple kids that have died as a result of vaping. We don't really understand what it was. Is it the chemical? Is it something in the wick? Is it something in the mixture? We don't really know. Is it formaldehyde? Is it vitamin? We don't know what it is that led those kids to die in the first place. But we do know that it does cause damage to the lungs. So anyone who has any kind of damage or any kind of insult to the lungs might be more susceptible to death if they get infected with the coronavirus.
Okay. So if you don't know you're at high risk, then should everyone just be taking the same precautions right now?
Definitely all of the medical professionals are recommending that everyone take the same precautions. Everyone needs to practice good social distancing.
Which we're clearly not doing right now.
Clearly not doing it. We all need to engage in significant hand washing, 20 seconds. Make sure you get the back of the hands, the fingernails. We all need to be utilizing hand sanitizer as much as possible. We need to restrict ourselves from taking our hands and touching our face. We know that that's something that's very hard for people. We're always wiping our nose, scratching
Constantly.
our eyes. We really want to be cognizant about keeping those hands away from our face. And so if we also want to be cognizant of our fever or our temperature. Mm-hmm. If you have a fever, that's the time to stay home. That's the time to stay away from others in your family. You can find a room or a corner or isolate yourself. And we know of many people that have had the virus, but their family members didn't contract the virus. So there is a way to kind of practice that social distancing even within your own home.
Well, let me ask you that, because that then leads to a question about, is it what is it called, herd immunity?
Herd immunity.
Herd immunity. So herd immunity is the belief that many people that are not in a high risk category, right, should all just go ahead and become infected. So family members just go ahead and infect one another so you can get through this together and then you're done with it. Is that?
Well, herd immunity is a little controversial. And essentially the belief is that, look, if enough people in society are infected with this bug and become immune to the bug, then the bug doesn't have a host to kind of move around and bounce around to, and to continue to transmit itself. So some people have put out this school of thought that if we can get 60% of the people, 60% of our population to have immunity, that maybe that would be enough for that the virus, so that the virus could not continue to spread. We're worried about over-utilizing the healthcare system.
Right.
So why not, in a very controlled manner, controlled infection with populations of people who would have the least likely chance of dying? So you take a population of people that would be young and healthy, no pre-existing conditions, don't smoke, don't vape, and you say, okay, Javits Center, instead of this being a hospital, we're going to have a 2-week infection party for 5,000 people. Okay. And you're going to get 5,000 people infected, and you're going to get 5,000 people, God willing, cured, and now they're out into society, going back to work, and then you bring in another wave of people, and you're constantly doing this until you get to that 60% point, and then hopefully the virus won't continue to spread. Okay. Very controversial. Right. It is not mainstream, but that is something that people are thinking
I'd
about.
be curious to see how many people would volunteer to do that. I'm not gonna lie.
I would
too, but not at the Javits Center. Like, if I could do it in my home, if I can be comfortable in my bed and just get it over with, I would like to do that. But I don't want to be in.
But the problem with that is you don't want to get infected and know that you're infected, and then go out into society and spread the infection. To someone who may not be able to handle it the way that you could. Right. So that's why you kind of are on lockdown. But we're on this social distancing thing anyway.
Right.
Everyone would be able to socially interact in that environment. You'd actually be able to play basketball, watch basketball, do whatever you want. 5,000 people all in one place.
So Friday night, we're all going to meet at the Javits Center.
We're all going to meet at Javits and get infected.
Okay, that's really controversial. We're going to forget. We're going to forget that you suggested that. Our
Listen,
whole family.
I didn't
our family
suggest
night
it.
out. No.
I'm only giving the contralateral side of the story.
No, I think it's a great idea. I would definitely consider doing that. Let's talk about the drug, because earlier this week, President Trump came out and said that this drug that is usually used to treat autoimmune diseases, lupus in particular, has shown some success potentially with patients. And what's happening now is that even doctors are beginning to abuse, I don't want to put doctors on the spot, but I've seen reports of doctors now over-prescribing this to patients so they can have a stash in case they get sick, they can try it. Is this the right thing to be doing right now?
Short, no, it's not the right thing. And funny thing is that I've had several people call me to write them prescriptions for this and to try to get this medication for them. It's not the right thing to do. We don't have a controlled study that actually indicates that it is effective. Okay. And that's what we as medical professionals operate with. We need data that says this treatment works. And we don't have that. We don't have a study that actually says this treatment is effective. So you have the president, who we all take as our leader, our surrogate leader, who's setting the tone for our country, telling us that this is a promising thing. Of course, you're going to have millions of people that are going to be asking
and try to get it
and try to do this. And then the people that actually need it, that need the antimalarials, who need the antibiotic portion in order to help with a respiratory infection, now those that need it can't find it. Right. And that's the travesty, because we really don't know if it works.
Right. Okay. Well, I know you have to get back to
doing nothing.
Doing nothing. So
I have nothing to do.
Well, let's talk about our kids then, because they go back to school next week, and I know parents are losing their minds in some cases with their kids. If your child does have a slight fever, or your child has the sniffles, or you have the sniffles or something, like, when do you actually go to the hospital, and when do you just watch them and observe for a few days? Is every single sniffle coronavirus?
Well, it's a difficult thing, right? Because we're very attuned to any sickness, and we don't even want to be around someone who might have the sniffles. So the challenge is right now it's spring.
Right.
And so and this is going to be a bad spring when it comes to pollen. And so allergies are going to be very rampant right now.
And mine are already. And you're not supposed to touch your face, but my eyes are itching, my nose is running. What do I do? Do I have corona, or should I just take some Zyrtec?
The first thing, yes, you should do the common things occur commonly, right? Okay. So allergies are very common. Let's treat the allergy. Take your Zyrtec, take an intranasal steroid, take anything that's going to quell that allergic symptom, but then also at the same time, take your temperature. Make sure you don't have a fever. Do you have chills? One of the big things that people are describing with the coronavirus infection is a change in taste, a change in smell.
Right.
So be aware of any of those changes. And that may be able to help you guide yourself whether or not this is something that I need to be concerned about and take my child to the hospital or to the doctor, or it just is common allergies.
Okay. And lastly, if you've had it already, can you still infect other people and can you still get it again?
Well, the last question first. We believe that this virus will behave just like every other virus. And once you have had a virus, been exposed to the virus, and your body has controlled that virus, you develop an immunity that in most cases is lifelong. You can only infect people when you're actually shedding the virus. So that is some of the unknown. We still don't know enough about this virus to know when you're actually shedding. That's why when people are they're getting multiple swab tests. So this test is actually testing for shedding of live virus. So day 1, you get a swab in your nose, and it may be negative. Day 2, you get a swab in your nose. It may be negative. Day 3, you do a swab in your nose, and you're shedding the virus, and that test is positive. So we don't exactly know at what point you got infected. We don't exactly know at what point you are shedding, but at least the recommendation is that 72 hours after you are symptom-free, you are likely okay to re-engage with other people, and so you're likely not shedding the virus any longer.
Got it.
Now, what we would love to have, and what I think that someone needs to create, and very quickly, is an immunity test that we can all take, because we all want to know if 80% of the people that get this virus are really asymptomatic, don't have any symptoms. You and I may have already had this virus.
I think I had it already.
Yeah, I think I've had it as well, as much as I travel. And so we want to know, why are we cooped up in the house? If we've already had it,
Right.
let's take a test, let's know, and then we're free to go.
Okay. Right.
So somebody make an immunity test, please.
Yeah. All right. And your lasting thought, I know I said that was the last question, but your lasting thought, should people really be taking this serious? What do you tell people? A lot of people are still going out. People are starting to get mad if they see you out roaming around the streets and in the grocery stores and all of that. Should we, or have we really felt the breadth of this virus yet here in the U.S.?
We haven't. And I think right now you are hearing so many cities, especially here in New York and in New Orleans, where the curve is going up so drastically. Part of that may be artifact because it took so long to get the test administered, and now we've had a backlog, and now all of a sudden there's a whole bunch of people that are being tested all at one time. And that could be causing that very sharp incline to the curve. But the reality is, this virus is very virulent. This virus lives on surfaces for weeks. This virus seems to attack us very easily. So it's going to spread throughout our communities. And that's why there is that thought that we sort of can't avoid it. Right. And that even if we shelter ourselves now,
where does it end?
It flattens for the moment, we might get through the summer, and then it may reemerge again in the fall. And so that's the concern. But it is, we're sitting here joking, but people are actually dying, and so it is a very serious concern that we all have to deal with.
Okay. Well, thank you. Thanks for joining us.
Anytime.
Get back to work.
Yep, I'm going.
Okay.
So I can find somebody to operate on.
Thank you.
You got it.